Good morning and welcome to the Brattleboro Citizens Breakfast. And today we're going to hear from Sophie Kasimow, who is a staff director with Bernie Sanders' office. And totally unrelated to this, I was writing to an arbitrator I used to work with in Boston and let him know that we would have a staff person from Bernie Sanders' office. So he wrote back, and this is an arbitral opinion, so you can take this, take this down. He said, give Bernie Sanders' staff person a big thank you. He is one of the few people in Washington who makes sense. And Sophie's going to try to make sense of health and aging from a federal policy perspective. I guess she'll probably say this, but I don't know if I can do her resume justice, is the staff director for the Health Committee. And I did memorize that that's Health, Education, Labor, and Pensions. And the subcommittee is on primary health and aging, and Bernie Sanders is the chair of that committee. We're going to do something a little bit different today. You all may have index cards, and somebody already turned one in with a question. But if you have questions, put them on index cards. After Sophie does her presentation, I'm going to collect the cards, and then we'll do questions. Sophie Kasimow.
Can you hear me? Okay, let me know if you want me to speak up a little bit. Thank you so much for that warm introduction and for inviting me to be here today. So I work for Senator Bernie Sanders as his staff director of the Subcommittee on Primary Health and Aging. We're under the umbrella of the larger Health, Education, Labor, and Pensions Committee. So today I'm going to share with you a little bit about the work of our subcommittee, a few policy and legislative updates on primary health care, services for seniors like congregate and home delivered meals, programs through the Older Americans Act, and provide a few comments about Social Security, and then hopefully we'll have a lively Q&A conversation. So just a little background on the subcommittee very briefly. We were formed in May of 2011. I started working for Senator Sanders in June of 2011. And it's one of three of the subcommittees under the Health, Education, Labor, and Pensions Committee. The portfolio includes many issues, including medical, dental, mental health care, the primary care workforce, long-term care services and supports, elder abuse, community health centers, healthcare disparities. The list goes on. So on primary care, so as you know, Vermont is doing better than many states, but the U.S. as a whole is in the midst of a major healthcare crisis. We spend almost twice as much per capita on healthcare as any other major country, yet our healthcare outcomes in terms of life expectancy, infant mortality, disease prevention are not particularly good. At the same time, millions of Americans lack access to primary medical, dental, and mental health care. And even after this first year of the implementation of the Affordable Care Act, 40 million Americans will still be without insurance, will still remain uninsured. Today, nearly 1 in 5 Americans lives in an area where there's a shortage of primary care providers, and 1 in 4 Americans lives in an area with a shortage of mental health providers. We need tens of thousands of new primary care physicians, nurses, nurse practitioners, physician's assistants, mental health and oral health providers, and other health professionals to ensure access to the primary care that people need. Lack of access to affordable dental care is also a huge problem, as untreated disease leads to pain, infection, and increased risk of serious medical conditions. As you may know, Senator Sanders is a champion for our nation's 1,200 federally qualified health centers, sometimes called FQHCs, federally qualified health centers, as well as the National Health Service Corps, which provides scholarships and loan repayment for primary care medical, mental, and oral health providers to provide care in underserved communities. And Senator Sanders got $11 billion in the Affordable Care Act for health centers, for community health centers, as well as $1.5 billion for the primary care workforce through the National Health Service Corps through these scholarships and loan repayment programs. So with these expansions over the last few years, community health centers now provide care for 22 million Americans. And with the recent expansion of community health centers to 11 centers with over 50 delivery sites in Vermont, by the end of this year, 1 in 4 Vermonters will be getting their primary health care at a community health center. That's over 160,000 Vermonters. That's actually higher per capita than any other state in the country. However, I know, as I'm sure many of you do, that there's a gap in the southern part of the state in access to federally qualified health centers. So hopefully there will be some continued expansion in Brattleboro with community health centers in the next few years, but right now the nearest sites are still too far away for many people in this area. Senator Sanders recently helped Vermont get $250,000 a year for 4 years for a total of $1 million in federal funding that the state will need to match to help hire primary care providers. These funds will provide loan repayment of up to $20,000 a year for primary medical, mental health, and oral health care clinicians that will come to work in underserved areas of Vermont. So one other priority and issue that we work on throughout the year, we hold several hearings. The Senator holds several subcommittee hearings throughout the year. And this year we've held several hearings calling attention to the primary care crisis and workforce shortages across the country. We held a hearing in January of 2013, 30 million new patients and 11 months to go, who will provide their primary care, to call attention to the severe primary care shortages that we're facing and that we expect will worsen as the population ages, the physician population retires, and millions of new people are seeking care through the Affordable Care Act, trying to see a clinician for the first time. In April of 2013, we followed up with a hearing that focused on programs that successfully filled the primary care workforce. So that includes programs like the National Health Service Corps, the scholarships and loan repayment for recent graduates to come work in underserved communities. We also talked about a program called the Teaching Health Center program, where community health centers become residency sites. So when you graduate from medical school, you need to go on to do a residency program, 3 or 4 years usually. And most of those residencies now are done in academic teaching hospitals. But there's a program called the Teaching Health Center program where community health centers across the country can actually become residency training sites. And so this was a program, a pretty small program that was passed as part of the Affordable Care Act. But it will need to be reauthorized. There aren't any in Vermont right now, but perhaps in the future there could be, especially because Vermont has such a strong network of community health centers. So in April, Senator Sanders chaired another hearing on the primary health care workforce that again focused on shortages of providers across the country and featured the testimony of a man named Stan Brock. He's the founder of a free clinic organization called Remote Area Medical, which organizes large-scale free weekend healthcare clinics, mostly in rural Appalachia, but also in urban areas as well. After more than a year of meeting with experts, convening hearings on the primary care crisis, the Senator introduced comprehensive primary care legislation this spring. The bill number, if any of you are interested in looking it up, is S2229. It's also available on the Senator's website, www.sanders.senate.gov. That would, among other things, expand primary care delivery sites, support training and loan repayment for providers, and increase the reimbursement for primary care. One of the statistics that we hear that has recently come out in published literature that the Senator cites is that we're going to need 50,000 new primary care providers, just physicians alone in the next decade, and tens of thousands of other clinicians as well. So I'd be interested to hear if any of you are having difficulty seeing a primary care provider. Maybe we can talk about that in the Q&A. In March of this year, the Senator held a hearing on access and cost and what the U.S. can learn from other countries. The Senator invited witnesses from several countries, including a doctor and former Minister of Health from Taiwan, and experts from Canada and Denmark, as well as an expert on the French healthcare system. And some of you may have attended the town hall meeting with the Danish ambassador that Senator Sanders held here in Brattleboro last May. The ambassador, among many, many topics that they talked about, the Danish ambassador talked a little bit about the Danish healthcare system. Senator Sanders spoke a little bit about the U.S. healthcare system, and there was a discussion about how the two countries can learn from each other's experiences. So on dental care, as many of you are aware, Senator Sanders is very committed to improving access to dental care. He knows that while we have made some strides, affordable, accessible dental care remains out of reach for many people. This includes seniors, as Medicare does not currently cover dental care for most people. In 2012, Senator Sanders introduced the Comprehensive Dental Reform Act, and last year, Senator Sanders reintroduced an updated version of that bill that would, among other things, expand dental insurance to millions of Americans who do not have coverage today through Medicare, Medicaid, Veterans Health Care, and the exchanges, and ensure that there are more places to go to access oral health care, like community health centers, so school-based health centers and give options for people who may be going to the emergency room to get dental care because they don't have any other option. The senator also released a report both on the primary care crisis and on the oral health care crisis, and they're both available on his website as well. So I'd like to spend a few minutes talking about the Older Americans Act. Another major priority for Senator Sanders has been the reauthorization of the Older Americans Act, which it passed in 1965, which funds many of the long-term services and supports for seniors, including congregate and home-delivered meals, transportation, preventive health services, legal services, and job training and community service opportunities. The job training program in Vermont is run by an organization called Vermont Associates, and they have an office just down the street. Senator Sanders negotiated a bipartisan bill with Senator Lamar Alexander from Tennessee, Republican Senator Lamar Alexander from Tennessee, and Democratic Senator Tom Harkin from Iowa over the summer of 2013. The law actually expired in September of 2011, so we've been working to get it reauthorized. The act can continue to be funded even though it has expired, but it would be a great thing if we're able to reauthorize it. And we can make some small improvements. So we negotiated the bill, the senator negotiated this bill over the summer of 2013, and the bill passed through the first major hurdle in October of 2013 when it passed out of the Health Committee. So it got a vote by the committee first before the entire Senate gets to vote on it, and it passed that through that process, which is a major hurdle for a bill to pass through, with overwhelming, very strong support. We were very pleased that many Vermont organizations and over 50 national organizations supported that bipartisan bill, including endorsements from N4A, AARP, and Meals on Wheels. We've heard from many of you over the last 3 years that the act is working well, but that it just needs more funding. Everyone across the country is being asked to do more with less as the senior population is growing rapidly, yet funding remains flat. Unfortunately, the progress of the bill has stalled. Some members of Congress want to change the way that the funding for the programs are allocated among the states and take money away from some states and give it to other states, but keep the total amount of funding the same. And because the total amount of funding for the program is flat, it's a bad time to ask some states to take a cut. Vermont would not be affected either way, more or less, by the proposal that's being discussed, but because it's a very difficult time to ask some states to see a cut, there's no additional funding for the program, that's where there's just the process is stalled. Senator Sanders knows that these programs are a wise investment because programs like these meals help keep people healthy and out of expensive hospital visits or nursing homes. Senator Sanders opposed the short-sighted sequestration cuts that have only compounded cuts to programs in recent years that lead to fewer seniors getting the services that they need. Since becoming chair of the subcommittee, Senator Sanders has led a letter to the Appropriations Committee calling for an increase in funding. Last year, he led the letter to the Appropriations Committee calling for a 12% increase in funding. It's a very strong letter, and 26 Democrats supported that letter. Unfortunately, we didn't have any Republicans that were interested in sending a letter of any kind. The Senate also voted unanimously for Senator Sanders' amendment to last year's budget resolution supporting the Older Americans Act. So I'm going to wrap up. I'm happy to talk more about the Older Americans Act in our Q&A, but let me wrap up with a few comments about Social Security. As you know, Social Security has not contributed one nickel to our debt deficit or our national debt. Social Security is not going broke. Social Security is independently funded through the payroll tax contributions from workers and employers, and it does not receive a dime from the federal treasury. Social Security has a surplus of $2.76 trillion and can pay out all of its benefits to eligible Americans until 2033. Passing legislation that Senator Sanders wrote to scrap the cap on taxable income above $250,000 would extend Social Security solvency for 47 years. And that's exactly what we must do. Although the American people now take Social Security for granted, we should never underestimate the incredibly positive impact that Social Security has had on our country. Since its inception 79 years ago, through good economic times and bad, Social Security has paid out every penny owed to eligible beneficiaries with minimal administrative costs. It's really a pretty extraordinary accomplishment. During this 79-year period, Social Security has succeeded in keeping millions of senior citizens, widows, orphans, and persons with disabilities out of poverty. Before it existed, over half of America's senior citizens lived in poverty. Today, less than 10% live in poverty. More than 58 million Americans now receive Social Security benefits, including over 134,000 Vermonters. Senator Sanders strongly believes that we must protect and expand Social Security so that every American can retire with dignity. Senator Sanders founded the Defending Social Security Caucus in the Senate, which now has over 20 members. And we stopped Social Security from being cut. Several years ago, virtually every Republican, a number of Democrats, and the President of the United States were calling for cuts in Social Security for a so-called Chained Consumer Price Index, Chained CPI. Senator Sanders sent a letter to the President urging him not to propose the changed CPI in his budget. This letter was signed by 15 senators, and this time around, the President listened. Was not included, the changed CPI was not included in the President's budget. The Senate also voted unanimously for Senator Sanders' amendment to last year's budget resolution in opposition to the changed CPI. So, working with grassroots organizations and senior groups throughout the country, Senator Sanders rallied the American people, and today very few politicians are talking about cutting Social Security. Thank you. That wraps up my prepared remarks, but I look forward to your questions. Thank you.
So earlier on, you were given a little index card if you have a question, and I'll go around and collect them. And while I do that, just to get us started and get on the roll, we have our first question. Will Vermont get the federal waiver needed to achieve single payer? And how can we bring this about? Let me go around and collect questions.
Great. So this is a great question. So Vermont is on track to become the first state in the country to have a single payer healthcare system. And the waiver that you asked about was actually written into the Affordable Care Act as an option. So states can be laboratories and experiment and create different systems, and maybe they can find a better way to deliver health care. And that waiver will go into place in 2017, period. It will happen in 2017. The law has been written. There have been some efforts to move that date up, but even if we're not successful in moving that date up or Vermont is not ready, then it will still happen in 2017. Does that answer your question? Great.
And let's see. So currently, Windham County lacks a dental care center, and folks have to travel 60 miles to Bennington County for extractions. How can we provide for one of Senator Sanders' centers here? We are not able to get seen at current ones that he's set up because they require you live in the community where they're located.
So this is something that Senator Sanders is very, very concerned about, that there are a lot of Vermonters that don't have access to dental care, especially in the southern part of the state. There is not a federally qualified health center that's providing that dental care. Sometimes people have to travel a very long way. Next year, there will be still a significant expansion of FQHCs, that's the acronym for Community Health Centers. And it's possible that one of the 11 health centers would be able to apply for an expansion opportunity, either to a new location and perhaps come south, or perhaps they could add on an additional service and add more dental chairs. So we're very hopeful that that will continue to expand next year. It's a real shortage area. It's a real problem. I don't have an immediate solution. We'll have to work with many people. You can, if you're working with, if you go to a health clinic that might be interested in becoming an FQHC, there's a lot of organizations and infrastructure here in the state that can start having some of those conversations. We also need more dentists to recruit more dentists, more dental hygienists, more dental providers to the area, and that's something that you can work on or speak with your current dental practitioners about.
We have a question about the Older Americans Act. So does the reauthorization of the Older Americans Act require more of a grassroots effort?
This is a great question. We have been working with many local, state, and national organizations over the last few years to move the process of reauthorization forward. And I do not underestimate for 1 second the power of the grassroots. Your voices are critical in Washington to getting legislation passed. When you call your representatives, it makes a big difference. In this case, your representatives in Vermont are fully supportive of moving forward with the Older Americans Act. We're ready to pass the bill tomorrow. So if you know people in other states, you can encourage them to reach out to their members of Congress and support the bill. They can sign on as a co-sponsor of the bill. The bill number is S-1562. It's called the Older Americans Act Reauthorization. It already passed out of the Health Committee. It's bipartisan legislation. You can also encourage your members of Congress to support the bill when they actually get a chance. If they're not on the committee, they didn't get a chance to vote on it in the committee, or they don't want to sign on as a co-sponsor, they can be encouraged to vote yes on the bill when they have the opportunity. You can also work with many national organizations that are representing and advocating for the passage of the Older Americans Act right now. So there are ways through the local AAA, the Area Agencies on Aging. I think here at Senior Solutions, that's the local Area Agency on Aging, and the others around the state, and work with AAAs and the National Association of Area Agencies on Aging, if you're involved with Meals on Wheels or AARP or any one of the National Council on Aging. There are many national aging organizations. In fact, you may be interested to know that there are 68 national aging organizations that we work with that form a coalition called the Leadership Council of Aging Organizations, also known by their acronym, which is LCAO, Leadership Council of Aging Organizations. And they do a lot of advocacy work with each other to try to support the reauthorization. I think there's been pretty overwhelming support for moving this bill forward. There's no opposition to the reauthorization that we have heard. It's really just gotten stuck over the funding issue. It's going to be tricky. Yeah, we'll see.
Here's a question about Social Security. So Congress has borrowed millions from the Social Security Trust Fund. Have they sent any back? And do they pay interest? How do we get the money back?
So Social Security doesn't receive a dime from the federal treasury and has a surplus right now. Senator Sanders has introduced legislation that would scrap the cap of $250,000 and extend the solvency of Social Security. But Social Security is a healthy, robust program that is very strong right now. It's not in financial danger. You may hear talking points that it's going to fall apart, debt. It's not true. It doesn't contribute to the deficit, it hasn't contributed to the debt. So I think that it's a strong program, and we're fighting to protect it and expand it.
That doesn't answer the question. Has Congress paid, they borrowed the money, but are they paying the interest on the loan, or are they paid back into the money?
So I don't know the answer. I think I'm maybe not able to answer that specific question, but we have someone in our office that actually works specifically on Social Security, so I can ask him to follow up with you.
Okay, thank you.
Yeah.
Let's see if I have the bill number on this right. What are the chances that S2229 will pass? This is on primary care. So, and what are the next steps for S2229?
So Senator Sanders introduced S2229. It's the first piece of legislation that was introduced in Congress that extends some very key primary care provisions that were passed a few years ago. Some of those programs existed prior to the implementation of the Affordable Care Act and got boosted funding in ACA. And some of those programs were new for the first time in 2010 with the passage of ACA. And this was the first bill that put forward a reauthorization of those programs. And those reauthorizations included funding for community health centers, funding for the National Health Service Corps, which provides loan repayment and scholarships, funding for this teaching health center program that I mentioned that funds residency programs, funds a few different types of residency programs, extends reimbursements, increases reimbursements for primary care through Medicare and Medicaid. These are policies, many of them are in place now, but they need to be extended to make sure that we don't lose ground on the work and progress that we've made on primary care over the last couple of years. The bill is not going to pass. The bill is in its current form, but we hope that it sets a marker for and puts out to the public a few of the key programs that the Congress will need to address in the next Congress. So every 2 years there's a new Congress, and a bill that's introduced in one Congress in one 2-year session expires at the end of that 2 years. And so 2 years later, when there's a new group of senators, or in the House case, the House, the bill has to be reintroduced. So we put this bill forward knowing that, it's not moving through the committee process, but many of the provisions that are in this bill, I think, have a very good chance of being reauthorized in the next Congress. So after the election come January of next year, there'll be a new Congress, and we will have to take up some of these provisions. And I think that we'll be fighting for many of these policies. So, I can keep talking about it, but let me know.
Well, we actually have a couple things we can do. That's the end of the index cards that I have for questions. But if other people have questions, and then maybe we can repeat the question, so I won't disturb the mic setup here. Or if you have some follow-up. Nancy.
I'd be glad to come up and voice my question if I
I guess I'm getting the cue. Just tell me the question. I'll repeat it.
I don't think I can.
If you don't have a question.
I do have a question.
Oh, okay.
Sorry. My name is Nancy Barber. I recently attended a meeting at my church, which was an exploratory session on life care community. This life care community is proposed for Keene. It is not affordable. And I wonder if the senator's office has any interest in, and I don't know how that would be put into effect, if the senator's office has any interest in exploring or offering some kind of program that would help people in the middle class, probably little lower middle class, to afford to be able to go to one of these kinds of places that is such a need. That's my, sorry.
Just say what a life care.
A life care community is, in this instance, the proposed facility in Keene is quite luxurious. Very nice apartments being proposed with full kitchens, and you can buy in at the 1-bedroom level or the 2-bedroom level or the whatever. The amenities include a long-term care insurance. You'll never be kicked out for inability to pay. There is a nursing facility there for illnesses, recovery from surgeries. There's a dementia care. There are transportation into town to the store and to doctor's appointments. It's a whole long list of really wonderful things. But for example, I don't need to live in the lap of luxury, which is what these places are. Is it possible for there to be such a facility in Windham County that wouldn't cost an arm and a leg to get into, who would provide similar cares and save money on the posh?
So
That's my question.
So if I can briefly summarize that. So does the senator have interest in supporting an affordable elderly life care center, or that concept?
Thank you so much, Nancy. So I don't know the answer to your specific question. I will ask the senator whether he's interested in supporting a legislation like that. We are very interested in supporting senior housing. I mean, we know there's a shortage of places, affordable places for seniors to live. And the country has not really dealt with long-term care options. You know, this is a big, there's a commission that has been formed, but not much has come out of it. And so you touch on a very important and very big issue that Washington and members of Congress haven't really tackled yet.
I did get another question that was asked to me. So, what are the chances for rebalancing reimbursements to medical professionals from specialty care to more money for primary care and family medicine?
One of the things that we hear about why young professionals, young doctors, go pick a specialty, it's because working in primary care, they hear can be very grueling, and the pay is not as good as going into a specialty. You can go, whether it's dermatology, radiology, anesthesiology, the salaries are considerably higher than being working in a small town in a small family practice. And medical school debt is very high, and this is true also for nurses, nurse practitioners, PAs who are working in primary care versus a specialty. They may graduate, people can graduate from training schools with $200,000, $300,000 in debt, and so they are in a pretty serious situation of having to make a decision. Do I want to buy a house? Am I going to start a family? How am I going to afford to pay my bills? And so we've seen a movement over the last couple decades towards some of these specialties. Vermont is doing better than many states in this regard, but could do even better. And we know that there are many vacancies for primary care, both physicians and nurses, nurse practitioners, PAs across the state. There are many, many vacancies that are very difficult to fill. They're very expensive to fill. And so one of the policy levers that federal legislators have at their disposal is to try to increase the reimbursement rate for primary care services. So if I'm talking to a patient, or I have to have a phone call with a patient, you might not be able to bill for that. And are there ways that you can raise the reimbursements on the kinds of things that primary care providers do all the time that we know keep people healthy, that might help do some of that rebalancing and make it more affordable, make it an option for people to stay and work in primary care who really want to, so that they don't drop out. Many medical school residents, they're in medical school because they want to provide patient care. They're very committed to serving their communities, and then over the course of their years in medical school, they fall away from their interest in primary care. So we have to find a way, both at the early stages, both at high school levels and college, to keep them interested in science and get more people interested, and get people from their communities. And we've had a couple hearings on this topic. Medical schools that recruit locally and train people in their communities and place people in training programs so they can do clinical rotations in rural health clinics, in community health centers in their communities, often stay in their communities. And that can help as well.
So I have another question that was handed to me. And it's about the question, there's no sentence, but non-traditional medical coverage. So I think what's being asked here is there contemplated under federal law coverage for complementary and alternative medicine?
Yes. This is something that I know the senator is interested in, but I don't have a lot of details to share with you about any policies. I think that he's done, you may want, I'll follow up with you about this so I can get you some more information, because it's something that he has talked about, but I don't know enough about it to speak to right now.
And did you still have a question?
No, I just wanted to tell her that Vernon Green and Vernon Hall have similar programs to what you were talking about. I don't know how costly they are, but I know several people who have taken advantage of it.
Do you have anything you would like to say in terms of summation or wrap up?
Just thank you. This has been great. Are there any other questions?
Could I just make a comment?
Sure.
I just wanted to speak to the life care community question you had. We had a group that was comprised of about 18 people that were residents of Westminster, Bellows Falls, and Putney that worked for about 3 years to create just what you were describing. And we had architectural designs, we had everything in place in terms of the wish list of what the residents were saying they would be willing to pay to move into this kind of a facility. And it wasn't necessarily luxurious, but it would have been quite adequate and very safe. The reason why the program just broke down, we didn't go any further, was totally related to medical costs and how our medical costs are being paid right now. So I'm very confident that as Vermont is moving into a different system of how people are paid to provide medical care, that in a couple of years we could probably look at that same project and be able to come up with a much stronger business plan so that people who need those kinds of supportive medical services, homemaking, even having nutritionists come in, or PTs and OTs, if somebody is post-surgery, I think we could actually create it in Vermont as we move closer to having a more equitable healthcare system.
Before you leave, you said your name is Joyce?
Oh, I'm Joyce Lemire from
And
Senior
you're-
Solutions.
Right. And so if people are interested in following up with you?
Oh, sure. My number is 802-885-2655. I'm not going to give you the senior helpline because we have a toll-free number, but I think you call me there and you'll get me directly.
What is your last name again?
Lemire, L-E-M-I-R-E. I'd be glad to talk to anybody about this subject.
Thank you.
We spent so much time and effort, and it was very disappointing that it didn't work.
Anything else?
Thank you very much.
Well, I can also stay after.
Yeah.
Great, okay, terrific.
Can I just follow up on my question about reimbursement? Because the amount that is reimbursed to surgical specialties and others is considerably higher, and that's set by the government, set by Medicare, rather than the reimbursement to primary health care, internal medicine, family medicine. That requires governmental action. Is that feasible politically?
Two quick things. So I would encourage you to go to the Senator's website and read his primary care report, which talks about this issue. Many of these reimbursement rates are set through a group called the RUC. It's R-U-C. I don't want to get the names wrong. Relative Uptake Committee, something like that. It's a committee of the American Medical Association. And these are a small group of providers across many specialties that get together and try to do a relative evaluation of the cost and reimbursement rates for each service. And then they submit those recommendations to Medicare to accept. And generally Medicare accepts those recommendations. They can make some changes. They're not required to take them exactly. But generally, in the past, they've taken those recommendations, they've taken many of those payment recommendations. And as you know, the private insurance across the country often follow Medicare's example and what Medicare will pay for. So there have been efforts, and as part of the ACA, there were more primary care family physicians that were added to that committee to try to balance out the voting of the voices and how those payments are made. And the report talks a little bit about this. There's also a recent report you may want to take a look at by the Institute of Medicine, the IOM, and they have been working for a long time on a report that just came out a few weeks ago on graduate medical education, GME. And it's about $10 billion a year that's spent by Medicare to train physicians at many teaching hospitals across the country. It's a lot of money. There's not a lot of transparency about how that money is spent. So one of the things that Senator Sanders' bill would do, S2229, is try to increase some of that transparency and have a little more local accountability for meeting the needs of the community. And so that all of those payment issues come together. The IOM report is, I'm sure it's many hundreds of pages. I haven't gotten a chance to read the whole thing yet, but I think there's an executive summary that might be of interest to you if you really want to dig into some of these payment issues.
Thank you.
Thank you. Thank you very much. You'll be around for a little bit longer for questions. Are there any announcements before we, Leon?
Yes, I'm Leon Boyd Jr. I'm the town service officer. Right here on this table we have a brochure for the Brattleboro Survivor's Guide. We can tell you all the places you need to go, you can go and get help. The other thing is, I'm a member of the United Healthcare Service, and they provide once a year free medical checkup. And that's the only ones I know that do this. I don't know if anybody else does it, but they've been very good with me and my wife. And I want you to know, this program here, it helps everybody that's probably in this room and helps the surrounding towns. If you don't have it, you can call me at 257-0063. And it's a local number, but the other number is 802. But I can help you if I can, or I can give you somebody, call 211, you can get all the help you can get. I've done it, it's worked, and I've gotten some of the people off the street corners in the grocery parking lot. And I also want to know what has Bernie got in mind for our service people. Because I know he's doing a great job as it is so far. And I know that Weber Insurance Hospital is blowing out. You know what I mean? It's spreading out. If they got to go outside of the building to have offices so they can promote medical care, and they're having a tough job getting doctors up there to do all the stuff that they need. And I'd like to have, Bernie, check that out. Bernie's done a lot for my family, and he's done a lot to help a lot of others, and I know this for a fact. And the thing that is, I'm appreciative of whatever he does, and I'm a supporter of him. I have nothing more to say other than if you need any information on this stuff, give me a call at 802-257-0063. I will help.
Thank you, Lynn. Any announcements of events happening? I'm going to try to run down 4 of them real quickly. Tomorrow there's a kickoff for Dean Corrin's campaign for Lieutenant Governor. It's in Montpelier. And Ellen Schwartz locally is coordinating carpooling. So if you're interested in going. The last forum for the Windham County Senate candidates is the 21st of August, next Thursday, 6:30 at the American Legion. You probably know, this may relate to the discussion that we had about an affordable care facility to some extent. There was a settlement with the state and Vermont Yankee to provide $2 million per year for 5 years to the state of Vermont for economic development. There was a meeting last night that Mary Kane was at. One of the questions that came up was affordable housing, and that seemed not to be on the radar last night. So if you have an idea, or you know someone who has an idea about a program that you want to get funded, there is a website, gowindham.gov, gowindham.gov. There are 2 workshops on August 19th. one in Townsend, and one in Vernon. I have information on that if you want further. I won't belabor that. And SEVEDS, the Southeastern Economic Development Strategies Group, is open to suggestions for future projects, and there's information about that as well. Any other announcements?
Bob,
Yes.
I have one announcement for ideas. I serve on the Brattleboro Housing Authority, and we are looking for up to 100 ideas for uses for Melrose Terrace once we have constructed Red Clover Commons, and that is the housing, planned housing for 55 people. There's still more people to move from the 80 people at Melrose, but we are really looking for as many ideas as possible for the uses of Melrose. We're not telling you what you can't do, but we really want to hear the broadest possible pie in the sky, blue sky ideas for how Melrose could be used that are non-governmental.
And Melrose was included in the SEDS report, and they do want an update in the next month, so anyone's working on that.
Thank you.
Sophie Kasimow from Senator Sanders' office, thank you.
Thank you.
And thank you all.